So I'll start by introducing myself. I'm Laura and I'm Seed's Media and Communications Officer, which means that if you've had any communication with Seed social media accounts over the past few months, there's a good chance that we've already spoken. And we wanted to hold this talk for a few reasons really, but with the first and foremost being that it gives us an opportunity to thank you all for your support over the past 6 months. As you know, we started our emergency food distribution around 6 months ago now, and I think I speak for all the team when I say that we've been blown away by your support. So that's primarily why I wanted to get together today. And yes, we also wanted to share a bit more about the situation than is possible to do so just on a Facebook post or a tweet. So thanks again for coming along. So just to give a little overview of the talk, Mark and Lisa will be providing an overview of both the ongoing situation in Madagascar as well as Seed's project and strategy to date. And Tsina will be sharing insights from the ground of Madagascar in Port Dauphin, and we'll be talking a little bit about the impact that the region has felt. And then we have Danielle, who will be sharing the results of our response so far, so its successes and where we're currently at with it. And we also have 2 other incredibly important members of our emergency response team in the audience. So hello to Dr. Mami and Lumba. Thank you both for coming along tonight. So yeah, now that I've waffled on for a little bit, I will ask the speakers to introduce themselves. Mark, do you want to kick us off?
Yep. Hello there. My name is Mark. I've met a lot of you and corresponded with a lot of you. I'm the managing director of the charity.
Lisa, do you want to say hello?
Yeah, my name's Lisa and I'm the Director of Programmes and Operations for Seed Madagascar. So I oversee the work in Madagascar, usually based in Fort Dauphin, but unfortunately, as so many of us, this year's been slightly different. So I'm currently based in the UK.
Brilliant. And Tsina?
Hello, my name is Tsina. I am the Deputy Director of Seed Madagascar. I am the only one who's left in Fort Dauphin, as the team, most of the team have flown to the UK. So yeah, I'm overseeing and doing most of the operational work on ground.
Brilliant. And Danielle?
Hi everyone, I'm Danielle. I'm the senior program officer for community health and education and WASH. So yeah, I will hopefully be moving to Madagascar as well as soon as we can.
Yeah, fingers crossed. Great, so now we've said our hellos, let's get started. If you have any questions, please either pop them in the chat box or feel free to ask them at the end, as there'll be plenty of time for Q&As and also chance for you to give us any feedback that you may have. So yeah, without further ado, Mark, could you give us a brief overview of Seed or introduction to Seed and an idea of the extent of the crisis currently being faced by those in southern Madagascar?
Yes, indeed. Yeah, lovely. Thank you very much, Laura. So yeah, firstly, just to add my own welcome and thanks to everyone for coming along and listening to us talk about this today. A lot of you are here as supporters and donors, which makes it extra special to be able to kind of feedback a little more about what we've been doing. And a lot of you will know our organisation. You'll know Seed. Some of you will even know Seed from way back in the day when we were as a FADI. And you'll know that that our work traditionally is much more about long-term sustainable development. Our work has been really focusing on resilience of communities and supporting the environment at the same time. And we focus on our core programmatic areas, which are maternal and sexual health, education, sustainable livelihoods, water and sanitation, and conservation and environment. And those are areas which we have numerous projects in. But humanitarian aid is not really our forte or traditionally an area which we work within. But we've been driven towards that, and we're going to tell you a little bit more about what has led us to that. You'll know also that as an organisation, we've now moved to working nationally, but a lot of our projects still focus in what I would call our home in the southeast of Madagascar, where we've got our main office and some 80 Malagasy staff who've been working throughout the pandemic, and with our 20 years and 25 years of work in that area, we've built a huge amount of trust and a huge rapport with those communities, many of which are connected to our staff. And I think that before even really considering the current crisis, I think we need to give a little shape to the context in which this all happens, and the communities in which we work. We need to remember that Madagascar, even before this food insecurity problem, was known as one of, or in fact, the poorest country in the world per capita. Life expectancy is incredibly low at 65, and infant mortality is a frightening 1 in 10. And there are big issues already with access to healthcare. Looking through some of the statistics to try and give a sense for this, I thought I would mention that we're here in the UK, there's one doctor for approximately every 300 people. When you go to sub-Saharan Africa, that drops to one doctor for every roughly 4,000 people. And in Madagascar, that drops even further. So there's one doctor for every 7,000 or 8,000 people. So there's incredibly low access to health professionals, very low access to schools. And of course, a lot of these issues combine to mean that we've got also a major issue in conservation, with around 90% of the forest in Madagascar already gone. So given that context, we've been working very, very hard. And of course, when the pandemic started, we started to move our operations to work, pushing out that public health message with that backdrop of lack of access and the sort of problems that I've been talking about. But at the end of 2020, we started to really see a growing problem associated with food security. We were seeing the worst drought that had hit Madagascar since 1981. We were starting to see issues like locust storms and dust storms across Madagascar. And it was clear that agriculture was down. I mean, actually, the stats are now saying that the harvest this year is going to be down about 40% on what it was over the past 5 years. And that has driven rising prices, along with COVID and issues with import, to mean that prices are constantly going up, and they are becoming very much out of the reach of the average person in Madagascar. And unfortunately, all of that is causing a major issue of food insecurity. And the World Food Programme now estimate that approximately 1.14 million people in Madagascar are in emergency food, in a dire emergency food situation, and very much at risk of famine. And one of the things I think we have to mention here is that food insecurity is happening all over the world at the moment. 1 in 9 children is going to bed hungry. But in Madagascar, there's a difference in that it's not war-torn, it's not driven by violence, it's driven by climate change and the effects of and the after effects of COVID. So within this dire situation around December, November of last year, we decided that we had to act. We decided that even though we're not a humanitarian organisation, we had to support those communities that we know and love. And that's where we where we really stepped in and made the decision to start this work. And at that point, to tell you a little bit more about our region and the work which we're doing, I'm going to hand back to Laura, who I believe is going to ask someone else to talk.
Yeah, thank you, Mark. It really is such a far-reaching crisis, and I think that Tsina will tell us a little bit more about how far it has reached in Anoush. Tsina, you have lived in Fort Dauphin and you were born there. Could you tell us a little bit more about how it's affected the region and the changes you've seen over the past few months?
Yes, thank you very much, Laura. Yes, usually it is the Andouille region which is feeding the Fort Dauphin town by bringing all of those sweet potatoes, their corns, the cassava to be sold here. And then the people in Anoushi is selling rice over to Andouille. But since the last 2 years, it was changed that now it's the food in Fort Dauphin is harvested because Andouille is became very dried out, and the surrounding district within the Anoushi is very dry as well. So people are cycling from there about 100 kilometers away from Fort Dauphin to buy cassava, and then that is brought back to their village to be sold or to be given to their family to be eaten. And food was harvested very early this year. Usually cassava time, it is in June, July, but it was harvested already since April and May, because there is nothing for people to eat in this region. And the Andouille have become very desert, and there was no rain at all since that time. During January, since last December, January and February, when people is like transplanting the rice, but it wasn't possible because it was dry since that time. And when we started to have a little rain, it have flooded, and there is no way for people to be able to transplant the rice. So the product, like the harvest, was very little comparing to the previous years. Usually we buy rice during harvesting time for 400 ariary or 500 ariary for a cup. But this year we have bought rice for 800 ariary at the start of the harvesting time, which is a double of the price that we usually buy it. And people from Andouille is running away from Andouille to come to Fort Dauphin to find job or to find somewhere to live or to find a place where children can be fed by organization or by the nuns. So this make like when the children are fed, the adults don't have anything, and crime have increased, thief and houses was broken into. So it's really bad in Fort Dauphin. The government have tried to send those people back to home and have given them something, but they refused to go because once they went, they have given some seed to be planted. When it will start to grow, locusts came as well, and it have eaten all of the maize, all of the cassava. So people now start to come back to Fort Dauphin as well at this time. So it never been this bad in town. This time of the year, we used to have lots of vegetables from Amboshari, but now there is almost none. There is less harvesting stuff. Food is like buying very expensive at the market, and sometimes it is not available. Like we usually buy oil, the imported food as well. We buy oil for 6,000 ariary a liter. Now we buy oil for 10,000 ariary a liter. So it's everything. It's everything that is had add up into one after one, from the climate change to the COVID, and now there is nothing for the Malagasy community, especially in this south part of the island, to eat or even to buy, to access at the market. Thank you, Laura.
Yeah, thank you for that, Tsina. I think it's really important to share that it's not just a crisis that's affecting rural towns, it's also spread into villages and, it's also spread into towns and cities as well. So there's not really anyone that hasn't been affected by this. Thanks for sharing your stories. So let's head on and ask Lisa now. We've heard from Mark about the situation in the south of the country and from Tsina about the impact on Fort Dauphin and the surrounding areas. How did SEED react to this growing crisis?
I think the first thing probably to say is with growing horror and a sense of impending doom, because although, you know, Mark's talked about the crisis and the massive scale of the crisis in the south, what we were seeing is, you know, not only the situation last summer, but how the predicted drought, the predicted famine, the failed harvests that would bring were going to affect food security in the coming year. And I think we all felt last summer that we were really standing on the edge of this huge disaster in the south of Madagascar. So, you know, Seed's a very small organization. There's this huge and growing disaster in the south of Madagascar, and we knew that we needed to act. But you know, I think it's worth having a little bit of a reflection as well on how difficult it was for Seed at that point. So a few months before, we had a third of our team evacuated from Madagascar. As kind of Tsina knows, the international staff left. That's a third of our team. It left the staff on the ground covering positions that we had left. It left us as international staff scattered all over the world, you know, trying to cope with sometimes 12-hour time differences, no overlap with Madagascar, working from sort of parents' homes and bedrooms, trying to keep Seed going. So a very, very difficult time for capacity. At the same time, obviously, we had COVID, and we were also trying to work around COVID restrictions. So we had the pandemic in Madagascar, as well as all over the world. We had to cope with office closures. At the last minute, we were looking at times when the team couldn't get to the bush because the bush was closed. And at times when, you know, we were also looking at our own staff and how to keep our staff as safe as possible whilst working in these really difficult situations. And then on top of that, we had, as Mark was saying, you know, we are a development NGO. So we plan, we think, and we kind of act long term, not in this very quick emergency humanitarian way. So we knew we had lots and lots of difficulties and challenges to overcome as we really thought about the context in which we were trying to implement some food insecurity work. So we had a look and thought about, okay, what's needed in the current crisis, and we really looked at two things. One is the immediate impact that we needed to make in terms of COVID, and the other one was in terms of food and food insecurity. And we looked really at what Seed was good at and tried to work out, well, considering we're development and we're good at what we do, what could we do in terms of those two things? So in terms of COVID, we partnered with the British Embassy and UNICEF, and we looked at how to give good messages about how to protect yourself with COVID through our social media networks. And we worked a lot in healthcare settings, particularly in terms of looking at how to disinfect healthcare clinics. We looked at how to put in water hand washing stations. We looked at a lot of training and a lot of support for the health staff who were also trying to work through this crisis. And then we looked at the food insecurity. And as we said, you know, we're a development organization and we didn't want to lose that. So as well as looking at the short-term immediate needs, we also kept an eye on what are the long-term needs. And as Mark said, this crisis really is about climate change. So we were looking at what could we do in terms of long-term climate resistant crops, food, as well as safeguarding the water supply. So we ran a pilot on looking at edible insects as well as another pilot looking at crops and what crops worked well in these new sort of very changed circumstances, and really as well kept going with our sort of particularly our rainwater harvesting and our wash work. And at the same time as we were doing that, we started then to think about, okay, what are people's immediate needs to get food on the table? And we knew that we would have to make some quite hard decisions because SEED is a small organization. The crisis is huge. It's across the whole of the south of Madagascar, and we knew we couldn't be everything to everyone. So we knew we had to make some hard decisions, and hard discussions needed to be had within SEED. So we looked at whether we wanted to look at our food distribution work in sort of to a wider geographical area and spread our funding and our capacity quite thin, but target a lot of people, or whether we wanted to focus our food distribution work and focus it around sort of the Fukantanes that we had traditionally worked in. We also looked at who we wanted to partner with this work, and also what we wanted to provide through this work. And we decided that SEED would have a strategy of focusing on a small geographical area, but do an absolutely fantastic and focused food distribution to the people living there. And although I say small, that still in the end covered 7 health clinics and 41 villages. So although I say quite small, actually it was a huge effort and covered actually quite a lot of the population that we've worked with now for 20 years. We know them as friends. They've looked after us when they've been ill, when our cars have broken down. You know, these are people from our community. We partnered with the healthcare clinics because we had worked with them all the way through COVID response. We had a really good relationship with them, and we knew that they, as much as we were really concerned about the families and children that they were seeing come into their clinics and those first signs of malnutrition. And in terms of what we wanted to provide, we decided that we wanted to provide the prepared food, so the little food sachets, for all children who were clinically malnourished, whether that's moderately acutely malnourished or severely acutely malnourished. And we decided we wanted to provide for all malnourished children. And we also wanted to provide for their families. So by giving their families food, we knew that the children would also get food, and we would protect the children by protecting the families. And that was the response that we decided on back in March. And I'm going to sort of pass over now to let Laura and Danielle introduce what we actually did.
Yeah, thank you for that, Lisa. I think that a lot of planning went into the processes around delivering the response, and I guess Danielle's just about to talk us through the results of that one. So over to you, Danielle. Danielle, we lost you.
All right, sorry guys, I was on mute.
Don't worry, it wouldn't be a normal Zoom if there wasn't a technical. I fully believe there was one.
Well, thank you, Laura, and thank you everyone else. Yeah, so let's get down to SEED's emergency food distribution program and what it actually entails and what's going on the ground. So as Lisa kind of mentioned, SEED responded to this crisis through the implementation of a food distribution program. So this targets 7 community health clinics, or CSBs, which span across 41 villages in the Noosh region. And there are no other NGOs or food relief agencies that are currently operating in those areas. So we can start with some definitions and acronyms just because it does get really confusing when we talk about malnutrition. So basically, malnutrition manifests itself in two main ways. So there's chronic malnutrition, which is inadequate nutrition over a long period of time, and that typically leads to stunting in height. And then there's acute malnutrition. So that's caused by a sharp decrease in food consumption or possibly illness, resulting in sudden weight loss. So acute malnutrition contributes to 50% of childhood deaths for children under 5. And that's the type of malnutrition that SEED is targeting with this project. And just to briefly go over some acronyms that will, I'm sure, come up a lot in this talk. So when we talk about MAM, that's moderate acute malnutrition. And then we have SAM, which is just the more severe form of acute malnutrition. And as Lisa mentioned, we are targeting both types of acute malnutrition. There's also SAM+, which is severe acute malnutrition with additional complications. So that can include anything from respiratory infections, edema or swelling, and dehydration. And we also have RUTF. So that is the therapeutic treatment or the ready-to-use therapeutic food that is given as treatment to all individuals who are malnourished. And when we talk about a CSB, as some of you I'm sure know, that's just a local community health center. So what is SEED actually doing on the ground? So for the first round, which just ended, SEED went out and trained 89 community health workers to screen children for malnutrition. So that included taking their height, weight, and the mid to upper arm circumference, which is how they diagnose malnutrition. So community health workers went out and they screened about 95% of children across those 41 villages. And then once those children were diagnosed, they were referred to their local health center for confirmation of their diagnosis. As you can see on the table here, during the screening that we did in February through the community health workers, we initially diagnosed 75 children with severe acute malnutrition, or SAM, and then 515 children with MAM. However, as soon as we started the program, there were an additional 63 children with severe acute malnutrition that were diagnosed by the community health center, and then we immediately onboarded them into our program for food distribution. So that brings us to a total for the first round of 653 malnourished children that we were supporting, as well as their families. And then children received treatment, and then we had monitoring and follow-up. So treatment for malnutrition typically is a 60-day cycle, so two 30-day periods. So children with moderate acute malnutrition receive ready-to-use therapeutic food, or RUTF, every 15 days, and that is supplied by SEED. And then they just go to their local community health center, so one of those 7 health centers, once every 15 days to receive that ration. And then for children with SAM, they were provided, they went to their local community health center once a week and received a slightly different form of RUTF that's actually supplied by the health center and by the government. And then children with severe acute malnutrition with complications. So SEED, after they were diagnosed, SEED covered their transportation costs of the child and 2 family members to the hospital in Fort Dauphin, and then they were inpatient, treated as inpatients. However, unfortunately for this first round, so there were 3 children diagnosed with SAM plus complications, but because of COVID being so bad and there was a lot of fear surrounding going to a hospital and catching COVID, they actually, for this round, went to their local health centers as well. And now all 3 of those children no longer have any complications and are not malnourished. And in addition to the RUTF that we provide, SEED also provides family support. So as Lisa mentioned, unprepared food. So we gave 16 kilograms of rice, 10 cups of beans, and 1.75 liters of fortified oil every 30 days to those families, alongside nutrition education. So our team went out there during those distributions and they discussed a few topics such as proper nutrition, how to identify and treat common childhood illnesses, and then health promoting hygiene behaviors, for instance, hand washing. So some successes from the first round. So SEED distributed almost 48,000 sachets of ready-to-use therapeutic food to 515 children with moderate acute malnutrition. And as I mentioned, the additional children with severe acute malnutrition received the RUTF from the CSBs. SEED distributed 36,006 kilograms of rice, a total of 24,301 cups of beans, and 3,588 liters of fortified oil to the families of all 653 children. So that was a total of over 4,000 family members receiving unprepared food. And the team also provided 2,336 nutrition education sessions with those families. So we received these numbers actually for the recovery rates to assess the project impact just a couple of weeks ago. And I think when our team saw these numbers, we were all really pleased. The recovery rates were actually higher than we even expected. So it was really, really great to see. So of the 138 children that were diagnosed with SAM, 137 were recovered. So there's only one child with SAM that will need continued treatment for SAM. So that's a 99% recovery rate. And just to note, so 10 of those children will require continued treatment as MAM cases, but that is a lot less severe than SAM. And among the children that were diagnosed with MAM, so there were 515 children, 504 recovered, which is a 94% recovery rate. And just a couple of challenges that we saw on the ground as we did this project, and we're kind of learning as we went along. So for the first one, when we created the budget for this project, we used data from a rapid needs assessment that SEED conducted in December of 2020. However, just because of improved screening, of course, a rise in COVID-19, and the rapidly escalating food insecurity in the region, when we went back to conduct the screening in February, there were a lot more cases of malnourished children than we initially anticipated. So the rise of these numbers led to an accelerated spending of the budget. It wasn't enough funds to support all of the children and families that we were distributing to. So SEED had to make a really difficult decision to cut those rations of unprepared food in half. So the numbers that I provided earlier of rice, beans, and oil, those were those half rations, just because it was the only way we could continue supplying food to as many children and families as we could. So the other challenge that we kind of saw was just the logistics of distributing food to so many children in different areas, especially in light of COVID-19. So one of the communities, for example, Shanarana, had 313 cases of malnutrition. So with COVID-19 restrictions in place, it meant that distribution of RUTF and unprepared food had to take place over the course of 4 or 5 days, because at the CSB, they could only accept a capacity of 50 visitors a day. And when we have a distribution schedule that's every 15 days, it's really difficult just to stay on schedule and make sure we're hitting all of those 7 health centers every 15 days, especially when one of them or 2 of them are taking 3 or 4 days. I mean, our incredible staff on the ground worked really hard. They were in the field every day for weeks, distributing food and just doing their best to stay on schedule and get as many children and families food as they could. And this is just kind of finishing up. I think it's really important when we talk about all of these numbers and statistics to just take a step back and just remember that each of those numbers is an individual. And I know Tsina touched on this a little bit in talking about what it's really like living there and being there on the ground. This is a story that some of our team on the ground did an interview, and she wanted to share her story. So this is Naravana, and she's with her 6-month-old daughter at Valisoa. Valisoa is one of the 138 children who was diagnosed with SAM, or severe acute malnutrition, during the first round of our program. So Naravana is a single mother trying to support her family of 5 girls and 1 boy. She lives in Shanarana, which is one of SEED's distribution sites. Her husband sadly died shortly after the birth of Valisoa, and her primary income relies on the farming of sweet potatoes and cassava. which are, of course, really impacted by the drought. And I know Tsina discussed this a lot as well. So like so many families in the region, especially after the onset of COVID-19, her family was left vulnerable to food insecurity. Naravana was approached by one of the SEED trained community health workers in February, who asked her to have her daughter checked for signs of malnutrition. Valasoa received a positive diagnosis for severe acute malnutrition, and Naravana became one of the many mothers whose child received RUTF from the local food from SEED, unprepared food. So she said to the team during an interview that she has one less worry, knowing she can provide her family with nutritious food during a period of heightened food insecurity in the South. And the good news is Valasoa is recovered and no longer malnourished. So I know they expressed their gratitude and appreciation for everything the program was doing. And I just think it's individuals like Naravana and Valasoa and so many other people like her that let us really realize how important the work that we're doing is in this food distribution. I really hope as we move forward into the second round of the project, we're able to support and keep having that positive impact on a lot more children and families like them. So thank you.
Yeah, thank you for that, Danielle. That was, I think I speak on behalf of everyone here when I say that those are some really amazing results, and it's down to a lot of hard work from the team and communities as well, all of us working together. So I guess I'll pass back to Mark now. Mark, how can we best expand our response and where do we go from here?
Thanks, Laura. Well, I mean, the big barrier here for SEED is getting the necessary finances, and we've struggled every step of the way to try and bring in the funds. I mean, for a small organisation, bringing in the sort of level of funding that is needed for this is extremely hard, because we're limited by our capacity, we're very limited by our reach. I'm pretty sure that virtually everyone listening to this has supported the project, and it's those supports which have led to those incredible recovery rates, and they're rates that we're very, very proud of. However, the situation is getting worse, and actually we're seeing that in those communities that we've seen those recovery rates, there are more children emerging now that are needing support and treatment, and our only way to combat that is to carry on doing the work which we're doing, to generate the funds to try and to be able to keep our infrastructure going, with the team that are working heroically to do all of this work at the sharp end of food distribution, and to get the supplies of food. So really what's needed is to try and find more funds. At present, we've raised in the region of about £60,000 over the course of the 6 months. The vast majority of that has come from donations from individuals. We've had a few grants from foundations, but the vast majority has come from individuals. Right now in our bank for this project, we have in the region of about £15,000. Now, to put that in a scale of timings, it's probably just over a month of food distribution going at full tilt. There are many ways that people can help. I mean, it's not just about you giving money. It's about raising awareness. We're seeing that as the word is getting out, and we're trying to encourage news. We're trying to encourage as many podcasts as we can do to get the word out, so that people understand the level of problem which is happening here, so that they can help children like Valasoa and relate to it and understand that this is about individual people. It's not about statistics, it's about people. So you can help by donating, you can help by sharing on the internet when you see our posts. You can set up Facebook appeals and try and draw other people in to this mission, which I believe we're all part of. to give a sense for what difference this can make. I mean, a sack of rice, which is 50 kilos, which is enough for family distribution for 3 periods. You're talking in the region of about 23 pounds for a sack of rice. So it's not a huge amount, but if we can mount up those 23 pounds, then we can then make a huge difference, and we can leap into this second round of distribution and hopefully get similar results to what we've had. The equation is simple. The more money we can raise, the more work which we can do, and the more children that we can support in what is a disaster. But the most important thing to say is thank you to everyone, because you've been part of this change. Your help has really been the thing that has made 90% of those 600 odd children. It's pushed them out of food insecurity. Okay, now our job is to keep them out and to expand as much as we possibly can to help others.
Yeah, thank you for that, Mark. I've popped a few links in the chat box for anyone interested to learn a bit more about what we're doing, and to also to read the stories from the field as well. So we do have one question. It's a sign of a thorough talk, I think. If we the lack of questions. Sam says, amazing impact and a wonderful story from Valasoa. Do you have a long-term goal with this program other than providing emergency food? How do you see it in the near future? I'll hand that one to Lisa, I think.
Thanks, Laura, and thank you, Sam. I mean, obviously, if we could all have our wishes, what we would see is no food insecurity in the south of Madagascar. You know, not particularly from SEED, but with SEED working in partnership with World Food Programme, UNICEF, USAID. You know, all of those big organisations that are trying to affect change in the south. But I think, you know, realistically, from SEED's point of view, I think what the last set of figures has shown us, as Danielle went in, is that, you know, the work that we do can be very, very effective. And that's been absolutely amazing to see. The results of the latest screening from the government health clinics that we received only this week showed that even in some of the communities where we're supporting, although the families and the children that we've supported have recovered, what we've seen in the 2-3 months since we've been doing our food distribution is more children with MAM and more children diagnosed with SAM coming up. So we know that there is more work to do in the communities that we're already supporting. So one of our goals in the kind of short and middle term would be the continuation of supporting those communities, so that we didn't see those children and those families like slowly retreating and having malnutrition again, and the complications that arises. So I would say, have a look at the communities. Let's try and keep those communities really stable. Let's try and keep the communities and the children safe from malnutrition, as well as, you know, we're never going to stop having one eye on that long-term goal. And we all know, you know, food security is to put food on the table for people today, tomorrow, next week. But in an ideal world, you know, when the crisis is over, we want to be working with families and communities for long-term climate change mitigation. And that's going to involve things like, you know, looking at the viability of edible insects, for example, that worked really well in our pilot, as well as taking the learning from the crops and which crops worked and which crops didn't, and putting those into effect. And again, you know, drought, lack of water is a real problem in the south. So working with other agencies and partners to see how we can improve good, safe water availability for people and families. So again, I think it's short term, keeping those communities safe. If we have the funding, let's expand, because the more communities and families that SEED can work with, the better the results are going to be for people, whilst always keeping an eye on, what's for tomorrow for people.
Yeah, certainly. It's a balance between long term and short term, I think, and that's how we get the best results. Another question from Joanne. Firstly, thank you for your lovely words, Joanne, very kind. She also asked, could an option be to partner with larger agencies such as UNICEF again, seeing as you really have the boots on the ground? I will hand that over to you, Mark.
Cool. We are partnering with UNICEF at the moment, but we're partnering with them on a slightly different project, which is also about long-term resilience. We're working with them on a huge WASH project, which is covering some 200,000 people, and has been running for the past year and a half. What we're finding, just in terms of food distribution, is that you have to go with the calls that are there and the funding lines that are available, and right now there really isn't those sort of calls coming out. So whilst we would love to partner with larger organisations, they're simply not there. And I think one of the key things to remember is that the reason why we stepped in the first place into these communities is because there was no other NGO, no other organisation acting. These people really were left, alone, and that's why we had to step in.
Yeah, I think SEED was amongst the first to respond to this crisis, and we have another question from Louise, who asks, I wonder how the current locust infestation will further impact emergency needs. Thank you for your question, Louise. I will pass that to Mark again.
Yeah. Locusts just put another layer of problems. For anyone kind of not familiar with what happens with locusts, their populations bloom, and they basically eat absolutely everything in their way. All vegetable matter is eaten, and in Madagascar it's no different. And there's been locust problems for many years, but given the dry, dusty conditions at the moment, they're likely to bloom further for months to come. And essentially what it does is there's even in places where there are crops in the field and there has been a little bit of rain, the locusts are likely to eat those crops, particularly rice and sweet potatoes and things like that. And it will just further exacerbate the situation, reducing the amount of local food that's available. We're already seeing that the food in the field is so incredibly precious that people, farmers are actually sleeping in the fields to guard their potatoes. They're pulling the vegetables out long before they're ready, so they're stunted and small to be sold in the markets. And it's a tragic situation, and add locusts into that equation, and then you've basically got another demand on what is a very, very limited supply.
Yes. Joanne has also said, I sit on the UN Nutrition Cluster meeting, so thankfully I have the chance to be an advocate for the Anushi region in particular. Well, it's lovely to have an ally. Okay, well, I think that brings us to the end of the talk, unless anyone has any last minute questions.
Well, share. I've just shared 2 links in case anyone individually fancies making donations or sharing these links. The first one is great for anyone who wants to make a donation in the UK, or in fact from anywhere. The second one there is particularly for people in the US, because it gets 501c3 status or tax exempt status, you know, from the US. So any donations can be offset against tax. I would also say that that I'm here. There's a myriad of ways that you can help, and I'm more than happy to talk to anyone one-to-one and work out how we can kind of leverage people's networks in order to get wider support.
Mm-hmm. Yeah, certainly. And from a media and communications or social media standpoint, I see a lot of your comments, likes and shares, and they certainly go a long way in helping us to raise awareness of our cause. So thank you so much for that. Okay, well, thanks a lot everyone for coming along. I hope that the stories and results that you've heard today have shown you how important your support has really been in alleviating some of the suffering of the people and communities living in Anushi. As you've heard, SEED's response is certainly not over just yet. So if you keep an eye on our social media accounts, you'll certainly see a lot more updates over the course of our remaining response. And yeah, please feel free to reach out with any questions or concerns on social media. I will be on there this evening if you want to get in touch, and also for the following next 100 and whatever evenings. So yeah, please do feel free to message, and thanks again. Hope you have a wonderful evening.
Thank you, everyone.
Thanks, everyone.
Thank you.
Goodbye.
Thank you, everyone. Bye.